Hi, my name is Feng Yuli. Today we are going to do the abdominal and the neural and also neural and the musculoskeletal assessment. And hello,
Hello,
and can I have your name?
my name is Purnima.
Okay, so did you mind today I will assess you like the muscular and the abdominal pain,
No.
abdominal assessment and the skeletal movements.
Mm-hmm.
Okay. First we're going to do the abdominal assessment. So can you lie down on the supine positions? First we're going to inspection the abdominal. You don't mind you did you want to pull?
No.
Okay, yeah, it's okay. So inspect I can see it's flat, no like abnormal or no up the masses. And now second one we're going to auscultate the bowel sound in 4 quadrants and um also the aortic and also the what do you call renal and the liver and the spleen. Okay, I heard the normal bowel sound in 4 quadrants. Now we have to listen to the aortic. And the iliac vascular sound. It's normal. Yes, I didn't hear any bruises in the throat. And the what do you call liver and the spleen and then thermal pulses. It's good. It's normal. And that is for the auscultations. Now we have to do the percussions. Do the same thing in 4 quadrant. It's normal. It's good. And then we're going to percuss the liver also. And the spleen. And then 4 quadrants spleen. And then now we're going to do the palpations. We're going to do a light touch movement first. Just use your one hand to palpate all 4 quadrants. Did you feel any pain when I feel to do the assessment? Okay, now we're going to do the deeper sensation, the palpations. Just let me know if you feel any pains, okay? And it's deeper. Good? Okay. Palpation, 4 quadrant liver. That I believe it's include all the four, and then I didn't see and didn't feel anything. Good. And then now you can sit up. Yeah, that's I finished the abdominal assessment. Now I'm going to do the range of motion, the shoulder. I'm going to begin with the shoulder, the neck, shoulder, and the knees and the ankles. So now I'm begin with the inspections. I can see it's symmetrical. I can see which side it's upper or lower, and there's no like masses. The skin is intact. Now I'm going to palpate. I'm going to palpate start the sternal to the clavicle and the AC process, the joint. And can you move up a little bit? Yeah. Didn't see any abnormality, and you do the same thing with opposite side. That's good. Patience, and then let's do some range of motion. So can you look do the same thing like extensions and yep, and the flexions, and then like super flexions, and what else? That is the shoulder, and then abductions, and then cross the hand. And can you also like move all the way up to touch your spula, and then also yeah, up in the back. Thank you. And then have C, and that is the shoulder. Now we're going to move your elbow. I'm going to feel it. The elbow here, it's good. It's intact. I didn't pick any abnormal. And then at the same time, I can look at the wrist and the hands, the fingers. It looks good. This side, it's good. It's intact. And now on the elbow, we're going to do the same thing. I'm going to let me do the pose. The what do you call the poses? Break poses. It's good. I heard it. I feel it. Okay, yeah, it's there. And then we're going to do the range of motions. Can you fix? Yeah, fix, and then extend. And then can you do the? Can you move abductions and abductions, and yes, and then you can supine and then prom, yes, good, and then your hand, you can move flex extends inward and outward, and then can you move your finger up and outward and then in, okay, and what else? Reflex. Let me palpate the poses first, the radial poses. It's here, and that's the reflex, inflex. Okay. Now we moving forward to the hip. If I miss anything, yeah, can you like laterally? Now I'm going to just inspect. I didn't see any abnormality, and it's good. Now I'm going to palpate the ilia, moving downward. I didn't feel anything. It's good. Now range of motions, I will tell her to extend, like move up and down, and then can you like supine? We're going to move up. Can you lift one more across? Yes. Do the same thing. Yes. Thank you. And then that's covered for the hip part. Thank you. Sit up. And then we're going to move downward, the lower extremity, the knee, and the feet. Yeah, can you remove? So first we're going to inspect. It's normal. It's good. I didn't see any abnormality, and I'm going to palpate the knee, the femur, and then going to the knee and the tibia and the papilla. Don't do the same thing on the other side. That's good. And then the posterior part. Good, thank you. I didn't feel any abnormality. It's good, it's normal. And moving downward, let me just finish for the palpations. The feet is warm, it's good. It's intact. I didn't feel any. I didn't feel any abnormality. For the knee part, I'm going to do the reflex sensation. I'm going to use the hammer. We're going to test the tender reflex over to see if she have any reflex. So I'm going to identify the tender over here and then to hit, and then just let me know if she have any movement. Okay, sorry. Thank you. And this side too. Thank you. This is the tender, and we're going to do the iliac. Sorry if I say it wrong. Iliac reflex. It's posterior of the knee. This is the tender, and I need to do it this way. Sorry if I hurt you. Same thing. Yeah, it's good. And then I forgot to do the upper extremity one, the reflections, the brachialysis, and then the L braces, and the shoulder over the reflex. This is need to here over here, and then do the same thing over here, and then over here if I'm not wrong. Thank you. And same thing over here. Good. And that's covered for the reflex. Spine reflex, the sensations. I think we'll find later. Then the spine. You want to do the spine first? Okay. Now we're going to do the spine first. For the spine, can you bend your spine? Let me. Yes, and let me expand. It's good. I didn't see abnormality. The spine looks straight. And then can you stand up? And then when I look at it, spine. Can you face the camera? And can you move the hip to the right side, and then another side, left side. And then can you rotate to the laterally on the right side, and then the left side. It's good. The range of motions is good. And for the hip, you're also going to do. Can you move? You did up with this? Yep. Up and you can move. Okay. Yes. Good. No. And the spine, I cover the spine, and then can you have see? We're going to do some like the sensations. If she have the sensory is intact or not. Let me do this first. Let me touch your skin and let me know which side you feel it, and it's very sharp or it's soft. Okay. You feel it? It's on the which side?
It's on the left side.
Okay, and then
It is soft.
It is soft,
Mm-hmm.
and then it's on which side?
Left side.
Left side. And how about here? You can feel that.
Yeah, right side.
And then
It is soft.
this
right side.
It's on the right side. This is the sternosis, and then the second part, we're going to do the graphio. We're going to, I'm going to write a number. You close your eyes and write. I'm going to write on something on your hand. Just let me know what you feel. Okay.
2,
Okay. And then you can do on the same thing and on the other side.
1,
Okay, good. And then we're going to do the 2-point discrimination. I'm going to use very sharp thingy to your skin, the point, and tell me, let me know which, how many points you feel.
1,
Okay, and this is
2,
okay, and on the side.
1, 2.
Okay, and you can also test your in your what you call in your lower extremity.
1, 2,
Okay.
1, 2.
Okay, good. This is 2-point discrimination, favela, and how to toe assessment is like you're going to move your hip up and then down to the other side. Yes, and then can you do the other sides for me? Thank you. And that is done for the sensations for the like muscular skeletal of the lower extremity. And then I'm going to do the cranial nerves assessment. The first one is the smell sensation, the cranial nerve one. I smell the sensations, yeah. Smell test. I'm going to let her smell, and then can you close one of your nose? Can you smell? And can you close another one? Can you smell? Good. Thank you. And that is the one. The 2 is basically your eye exam, your eye, the cranial optic nerve. Okay, good. So I'm going to see her eyes. Okay, it's intact. I can see the nerve. Same thing over here. It's good. And that is the cranial 2. And then cranial 3. I'm going to see the eyes reflex. And then I can see it's reflex is do the same thing on the other side. It's good. And then it's intact. 3, 4, and then 6 is intact. That's basically your eye. And the number 5 is your facial, your jaw's movements, and then also the sensations. So I'm going to feel over here, and can you move your jaw side to side? Yep, and thank you. And then you can feel it, right? Okay. Let me do this one. Thank you. So cranial 5 is intact. Cranial 7 it's your gap reflex. Sorry. Cranial nerve is your smile. Also the facials, the smile, the muscle movements. Can you smile for me? It's good. And can you make a kiss movement? Oh, okay. And then kiss movement, right? To the air. Okay. Yeah. So her cranial 7 is intact. Cranial 5 is your shoulder movement.
Cranial 8.
The gap reflex.
The cranial 8 is hearing.
Sorry. And then the 9 was cranial 8 is your hearing test. We also cover in the head to toe assessment. So I'm going to close his eyes and then whisper to let me know if you heard my words, okay?
Apple.
Okay. And then do other sides.
Banana.
Okay, thank you. Queen your 8, Queen your 9.
9 and 10.
Is 9 and 10. It's your show.
Swallow.
The gap reflect the show. The swallow. And can you swallow for me? Yeah, I can see the swallow movements. Is 9 and 10. 11 is the shoulder one, right? Sorry, it's so confused. The shoulder one. Can you make up and down movements? Okay, good. So it's intact. Queen 11, 12. The last part is the tongue movement. So can you make like say ah? I can see it's intact. That is, I cover all the cranial nerves system, and thank you pretty much. Do I'm going to test the balance test. So can you just walk normally and then backward to I get back. Thank you. And then can you walk with your toes? Go straight and then come back. And then yeah, can you come back also? And then can you walk with your toes? The heels. Thank you. Can you walk back? And what else? And we're going to do the rumbar test. Rumbar, and can you extend and super positions? Yes. And then can you close your eyes? Okay, so her balance is normal. I didn't see she's like abnormality. And then we're going to do the sorry if I say it wrong, Promer drips. So I'm going to put some pressures and then to see is normal or abnormal. Thank you. And sorry, I can do one side or both sides. So, thank you. Okay, so I'm covered for the balances test. Thank you so much.
Yeah.